So this session is about showcasing or update on AI in eye images for systemic health, collaboration with Derbarl Yerrigan Health Services, and we've got Dr. Jocelyn Drinkwater, who is a research fellow at Lions Outback Vision, and she's been involved in a few projects with Lions Outback, led by Angus Turner. This presentation will discuss the use of artificial intelligence both in screening for diabetic retinopathy and for detecting other conditions such as risk of heart disease and stroke from an eye photo. The research Lions Outback Vision have completed in collaboration with Derbarl Yerrigan Health Service, as well as other work from Pilbara, which will be presented today as well. So if you could please join me in welcoming Dr. Jocelyn.
Good afternoon, everyone, and thanks for the opportunity to present today. So just firstly, just to acknowledge the traditional owners of the land and to pay my respects to elders past, present and emerging. Today, just talking a bit about AI and the use of AI with eye images. And I feel I might go over a bit of what has already been mentioned this morning. But before embarking on some of the data, I wanted to do a brief overview of what AI actually is. So artificial intelligence is basically a computer system that can take the job of what would normally require human intelligence. So this could be anything from recognizing that a dog is a dog, to translating languages, decision making, and it can also include diagnosis. So under the umbrella of artificial intelligence, you might have come across the terms of machine learning or deep learning. So machine learning is when you've got some AI that can actually improve over time when it's given more data. And then if you break that down even further, you can get deep learning. And basically that's just even more capable than machine learning. With machine learning, there's two main ways that it's done. So you can either have supervised learning, which is where you can say to a computer that this is an apple, or a tomato, this is a carrot, this is a capsicum, and then the computer learns from that and then you can test it on some data. The other way that it can happen is that you can just give a computer a whole pile of data. And you don't tell it anything, and then it can actually figure it out by itself, which is very cool. However, both of these methods have their pros and cons. So if you have supervised learning, it does have a high degree of accuracy, but you still require a large amount of data, and it is expensive, and it is time consuming. With unsupervised learning, you don't have someone that is manually labeling every image, and it can find some hidden patterns, but sometimes the results can be subjective, they can overfit the data. What we're finding now is that sometimes you're getting a mix of these two. So you can get semi-supervised learning, and this is trying to get the best of both worlds. So what we found is that deep learning models tend to work really well on the population that they were intended to, that they were developed on. But then if you want to take that AI and use it somewhere else, you really need to check if it works there first. So if you've got a model that can predict diabetic retinopathy really well, that was developed in the States, you need to test it here before just using it here. The other thing to note is that when an AI model is generated, minority groups can sometimes be underrepresented. And in this case, the results can actually be biased for those groups. So this leads me on to diabetic retinopathy, and I'm sure everybody in this room has heard of diabetic retinopathy and has an understanding of what it is. Basically, it is when you get damage to the back of your eye, to the blood vessels at the back of your eye from diabetes. Unfortunately, it is one of the leading causes of vision loss, and unfortunately, it does tend to affect Aboriginal Australians more. So our research has shown that they're about twice as likely to get diabetic retinopathy and about 6 times more likely to have at least referable diabetic retinopathy. The good news, as mentioned before, is that this is treatable, and with screening, you can actually prevent that vision loss if you have the screening and the needed treatment. there is the gap that's already been mentioned, that not enough people are being screened. So some data has shown that about 50%, I think it was 53%, of Aboriginal people throughout Australia are actually getting the screening every year that's recommended. But we've done some auditing up just around the Broome area, and we're finding that only about 30% of Aboriginal people are actually getting the screening in the more remote areas. So our point is that we think AI has a really important role to play in diabetic retinopathy screening. We've heard earlier today about how in the AMSs there's a lot of cameras and that you can take an eye photo, but then it was mentioned about how an ophthalmologist was only coming every couple of months to grade the images. I know sometimes we've had images emailed to us for grading, but that can often cause a delay in treatment. So if we can have AI to give an on-the-spot diagnosis for diabetic retinopathy, this could really change the way diabetic retinopathy screening is done and give access to this in remote areas especially. So if we had AI for diabetic retinopathy screening, it can be done on country with automatic retinal cameras. Anybody can actually be trained to do the screening, and it doesn't need an optometrist or an ophthalmologist there to actually do this. What we don't really know is how acceptable the AI is and how well it works for Aboriginal and Torres Strait Islander people. So there's a lot of AI out there, and I just want to talk about this one project that we have done. It was mentioned a little bit earlier by Dr. Hunt, but there is a Google AI that was developed for the detection of diabetic retinopathy from a colour retinal photograph. So this was using the supervised machine learning. So they had a model that was trained from 2.3 million labelled photographs. So what we wanted to check was how well does the Google AI work in Aboriginal people. We collaborated with Derbarl Yerrigan, and we used photos that were taken at a Derbarl clinic from July 2013 to October 2020. These images were run through the AI, and then they were also graded by specialists. And then what they did was they compared the accuracy of the AI to the specialist. So there were 1,682 images, and basically the Google deep learning system was able to detect disease better than a retinal specialist. And I've got a table here for you. So this one shows sensitivity and specificity, and basically the closer the number is to 100, the better it works. Sensitivity is being able to pick up disease when it's actually there. So you can see on the top line was 98% sensitive for the deep learning system versus 87% with a retinal specialist. So it was significantly better for the deep learning system. I thought that was really quite impressive. So that one has worked really well. There are other AI systems that we have looked at, but we have found that this one is working the best in Aboriginal people so far. So sensitivity is the ability to pick up a positive case if they actually do have diabetic retinopathy, where the specificity is to say it's negative when it's actually negative. So there's no retinopathy when there is no retinopathy. So that wasn't as good, no. A lot of the time you want above 85. So it's still it's working really well. Yeah. So you might have heard that the eye is a window to the soul. And we have, there's been in the literature the term oculomics, where you can actually use an eye photo to look at things that actually are not to do with the eye. So you can either use an eye photo or you can use other eye imaging techniques such as OCT, OCTA, to predict whether someone is going to have a heart attack or a stroke, Parkinson's disease, other systemic diseases in the body. I want to talk about RetFound. So RetFound is actually based off self-supervised learning, so when there were no labels given to images. So with RetFound, they have trained about 1 million iPhotos and about, I think it was 700,000 OCT images through the software. And then the model is pre-trained using these iPhotos and OCT images, and then it is fine-tuned to more specific tasks. This AI has been used for diagnosing eye diseases, such as diabetic retinopathy and glaucoma, but then also it's been used to predict cardiovascular disease and Parkinson's disease in the future. So taking a photo of your eye now and then using that to say in 3 years' time your risk of a heart attack is this. So with RetFound, it was actually compared to a lot of other AI models. And the next slide is a little bit of a detailed graph. So I haven't put up the information for diabetic retinopathy because I can tell you it worked really well, but I thought the oculomic side was really interesting. This table is quite complicated, but on the top line is the results from the color fundus photos, so your normal eye photos. The ones on the bottom are all the OCT images. And this is comparing the RetFound in the really dark blue to other AI programs, looking at how well it was able to predict myocardial infarction or heart attack, heart failure, ischemic stroke, and Parkinson's disease. For all of them, you can see that the RetFound model actually worked better, and it was significantly better. And they found this as well with diabetic retinopathy. So this foundational model is able to identify and diagnose diabetic retinopathy better than other AI, as well as looking at these other systemic diseases. So the paper showed that you're able to fine-tune this model, this AI model, to the population that you want to use it in, and it can potentially save 80% of your training time. So rather than taking months to train an AI program, it can just take a few weeks to fine-tune it to your data, and it doesn't require as many images. So this paper was done with some collaborators of ours in the UK, and what we want to do is actually test how well this model works for Aboriginal people and to see whether we can, if we need to, fine-tune it. So we have put in a request with Derbarl to actually plan a project to assess how well RetFound works, both for looking at diabetic retinopathy and for the prediction of cardiovascular disease. At the moment, we don't think it will be that useful to look at Parkinson's disease because the prevalence is actually quite low in Aboriginal people. So that's what we're hoping to do in the future. So in conclusion, it's important to validate deep learning systems in the population where they are to be used. And our research will help determine the role of AI in diabetic retinopathy screening. And I don't want to go too much into that because I know Angus's next talk is going to lead on to what we're doing next. But there is definitely the potential to use diabetic retinopathy screening to also detect other systemic conditions, such as heart attack and stroke.